Well, thank you for all of the difference that you make, both with our patients and our healthcare providers, and everywhere that you go. I mean, we're talking today about the ED bridge, and the fact that, when peers are involved, our data shows that the patient is twice as likely to get into treatment. I mean, what a powerful impact that you're having. They're not just then going down that rabbit hole of continued addiction, but they're reaching out for help.
Yes. Yeah, absolutely. And then, if they're struggling or they forget who their care coordinator is in OBOT, like, we just help be like, okay, we'll call them together and we'll get them back set up and communicating again. And it's a whole big teamwork. And that's the big thing. I'm big into team and unity. And so basically our hashtag is all in. So, we're all in this together. And that's what I love about, with the ED bridge and then the OBOT is we all are just trying to do the best that we can and to get the individual the best help that they can get and receive.
And for people that don't understand, the word OBOT means Office-Based Opioid Treatment Program, and what you're doing is helping them cross over from that acute care setting in the ED over to ongoing care in the Office-Based Opioid Treatment Program. And all things can fall apart, right? There's all kinds of things that can get very confusing for patients.
Absolutely.
Ranging from, where do I go? How do I show up? Do I have to have a mask, right?
Yeah.
It's more complicated now than ever. How do I zoom in, and what is Zoom?
So a lot of time, yes, it's the phone. So we are being helpful in our department when we can. They can use our phone to call in and to do the appropriate 1 day a week group that they are that they show up for. And basically that's what we try to do. If they don't have a phone at the moment, then we'll work on getting them a phone. We try to deal with all the barriers one thing at a time, because there's a lot of barriers, but we're getting there.
Yeah, that peer recovery center that's right down the hall from us is a great go-to place for patients. And you go so beyond even helping them get into the treatment program, but a number of them struggle in so many ways. The homelessness just absolutely breaks my heart. And I know you help them try to pursue housing as one major barrier to overcome.
Yeah, we do the best that we can. And so while we're trying to, it takes days sometimes to get somebody on the phone or try to get them in somewhere. So basically what we do is we always have a peer that's in the office stationed, so they can hang out there. We have coffee, we have games, we will do groups there at times. Limited, depends with how many people are there at once. But it's a safe space for them to go to from 8 to 5 at least, and that makes me feel better than anything.
Well, I know that support has meant the world to our patients, and it's actually meant the difference between successfully staying in treatment versus having life so fall apart that they really can't even manage to show up with a phone call, right?
Right.
It can fall apart so quickly, and you all are the glue that really, helps them keep their act together. And you're not just in the ED bridge, you're all over the place. I don't know how you do it, but you cover the bases over when a patient has, for example, sepsis. You'll follow them up to 5 West. You follow them everywhere, even if they're not at Carilion. It seems like you're able to follow them to other facilities.
So if they're in a different program, we, if they feel the need to still work with a peer, we will still talk to them 1 day a week, twice a week. They're allowed to still come to our office. So we're everywhere. We have patients, like you were saying, that are sepsis or osmolytis due to IV use. They are typically on 5 West from 6 to 8 weeks to complete their antibiotics. So we work with them heavily about 3 times a week, and plus groups over there, and help while they're getting medically helped to add in the recovery part if they choose to do so. And then we follow them when they are discharged.
So you help run groups there?
Well, yep.
Yes. And what are some of the goals of those groups?
A lot of times is to complete their antibiotics.
Okay. To get very basic about it,
Yes.
right?
And to work on, like, we do groups on smart recovery, goals group, and then we do a MARA group, the Medication Assistant Recovery Anonymous group. Really, anything that they want to do, we'll let them choose a topic. But it's really just to get down the nitty gritty because, I mean, they're there, they can't go anywhere. So we really work on the recovery action plan, the RAP plan, and really just helping them with their behaviors and transitioning, how to deal with being super sick and how to, learn recovery habits while they're in the hospital so they can implement them when they transition out.
It's so incredible to hear you say that. It's as basic as helping them complete their treatment.
Yes.
And I think
Very
that's
important.
a really valuable message for hospitals to hear.
Absolutely.
Is that you can be a key part of that healthcare team to make the healthcare itself
Yes.
successful.
That's our plan. That's what we want, of course. And, and then watch the patients grow each week. And then to see them when they graduate is even better. We give them certificates because if they participate a lot in groups or psychosocial therapy, it just goes a long way. And to see them accomplish things and they actually see it and feel it and know it goes a long way.
And then you're also in the inpatient unit in psychiatry as well, upstairs on the floor.
Yeah, we do 2 groups on 4 rehab 4 a week and 2 groups on rehab 5, and then the social workers will send referrals for peers to meet with who they see fit to meet with patients, and so we're up there as well. Where they have anyone to talk to if they feel necessary.
Do you then help them transition from the inpatient setting to outpatient care?
In a sense, yes. We definitely have it where they meet with our peers one-on-one if they feel to do so. A lot of times they are not local, so it just depends, but we always have, hopefully they have a phone, but, they know to call, because our biggest thing is try to limit re-entry in the emergency room again. So having peers being around on rehab 4 and 5 is that they will call us and we will handle like maybe a question like, hey, I don't know where my medication is. I don't know when my next appointment was, and just to follow up with that so they don't end up back in the ED for something like that where we could handle it with them together.
So you're helping reduce return ED visits,
absolutely.
which is also another really big deal for healthcare systems.
Yes.
To hear about the value of peers.